Hello and welcome everyone. Here is Dr. Rabah from the eMRCOG online sessions, and I'm sharing with you the key points of the guideline of the VTE thromboprophylaxis during the pregnancy and postpartum. So this is as per the group members' request. So my dear champions, let's go through the important point of this guideline, which is very important to understand very well and clear your concepts to solve the eMRCOG in the exam. So what are the rules of the VTE assessment? Because all of you know that the pregnancy and postpartum is the state of hypercoagulability. So the mother will be at increased risk of developing blood clots during the pregnancy and postpartum. So for that, all the women in the UK will be offered assessment of their VTE risk during booking, and it will be repeated every time this woman will, if admitted during the pregnancy and also after the delivery. The general rules of this thromboprophylaxis is that we are going to be guided by the scoring system of the RCOG, and the algorithm is very famous. So what you will do is you are going to count the risk in each particular woman, and if the woman score 4 or more, that's an indication to start the VTE prophylaxis by the low molecular weight heparin from early pregnancy, as early as possible, or at the time the assessment is done, until after delivery, 6 weeks. And it's mandatory that you will again repeat the assessment after delivery, but anyway, any woman who received low molecular weight heparin during the pregnancy, the course of the pregnancy, she will continue 6 weeks postpartum. If the woman had a total score of 3, the 3 means that you will consider the prophylaxis from 28 weeks and also for 6 weeks postpartum. The assessment after delivery, what is the rule? The rule of after delivery says if you have a score 2, and this is apply for a woman who was not taking any low molecular weight heparin during her pregnancy. So, for example, you have a woman who was a low-risk pregnancy, okay? So after the delivery, you have to do the VTE risk assessment again, and you're going to advise her whether or not she received low molecular weight heparin, or it's enough to give her advice of mobilization and avoid dehydration. The score 3, okay, this is more than 3, sorry, in the post-delivery, then you will consider extending the prophylaxis. There are situations also that you have to know where the prophylaxis is going to be offered for a temporary period. Like what? Like a woman who's admitted during the pregnancy, okay, in the hospital, or readmission after delivery, okay, she came, for example, with postpartum sepsis. So, of course, she must have low molecular weight heparin during that time, unless the low molecular weight heparin is contraindicated or there is high risk of bleeding. So a woman, for example, who have hyperemesis gravidarum that require hospital admission, okay, will be considered as a temporary reason to offer the woman low molecular weight heparin during admission again until she improved and she discharged home. So those are the rules, general rules, okay? And everybody is aware of these rules, but the problem is sometimes people get conflicted or get confused when they apply the scoring system from this algorithm, because this is a very important algorithm, which I advise all of you to print it out and you keep a version with you. And let's make it a game, my dear friends. Let's have a look there. Of course, I give you my advice, as always, that you divide each algorithm into parts, okay? So it will be easily understandable and you can remember, easy way. It can make more sense to you. So here, I'm going to discuss with you how to calculate the risk during the pregnancy, okay? So you will find that they have different color system, okay? So the color system here, for here, the first one is a red one. What is this red one? This red one is for a woman who is considered as a high risk, okay? Or sometimes very high risk, where this condition alone require starting of the low molecular weight heparin from early pregnancy, and it's a score 4. What is this condition that's considered risky? This is a woman with previous VTE, a woman with previous VTE. So the woman had thromboembolism, can be a pulmonary embolism, can be a DVT. For example, in a previous pregnancy or in a post-delivery, okay, period. But this is not related to major surgery. Okay, so what is the difference between this? I'll tell you, my dears. If the woman developed the DVT for a reason that is estrogen related, okay, for example, a woman developed the DVT while she was on a COC. She developed the DVT during the pregnancy, hormone-related reasons. So this woman, okay, we will call that her DVT is unprovoked, okay? So unprovoked pregnancy, DVT during the pregnancy or related to a hormonal reason, okay, this will take 4. How about a woman who got a traffic accident, for example, okay, or she had knee replacement surgery, and during the recovery, she developed the DVT. This is surgery related, and the surgery related have a score 3, not 4. And we call it a provoked, okay? So if it is a provoked by major surgery, it will take score 3, and here it will be in the orange table, but not in the red one, okay? So a woman developed a DVT in the previous pregnancy, score 4, starting low molecular weight heparin from the early pregnancy. And we're going to speak in details about the difference between those women even. So in this category, this special category, the red one, this is a high risk or a very high risk category, okay? I need to know that I will start the low molecular weight heparin as early as possible, okay? And we will come to the details more, you know, and give you more tips in this part in the next table, okay? So here, another woman who have a previous thromboembolism provoked by major surgery. This will take 3. Score 3, if this is the only risk factor that she have, means that we will consider the VTE, thromboprophylaxis, from when? Yes, everyone is correct. This is from 28 weeks and 6 weeks postpartum. Excellent. High risk thrombophilia. High risk thrombophilia means that the woman is carry the gene of the high risk thrombophilia, but not symptomatic yet. So this is the tips here, okay? This is the tricky point, that the women who have high risk thrombophilia alone, okay, have the score of 3, and this is a special case scenario. And here I will tell you, my dear friend, this is a special scenario, need more discussion. Yeah, so it's alone, it will be considered for 28 weeks postpartum, but recommend 6 weeks. Sorry, 28 in the antenatal and recommended 6 weeks postpartum. Oh, silly me, I need my coffee. So, dear friends, medical comorbidity, any chronic medical problems like active systemic lupus, inflammatory polyarthropathy, inflammatory bowel disease, cancer, or heart failure, nephrotic syndrome, or type 1 diabetes, but not all type 1 diabetes, type 1 diabetes with nephropathy, okay? So it's very important, because when you study and revise the guideline of the diabetes in pregnancy, okay? You have to differentiate between the people who have diabetes type 1 only, or it's complicated with nephropathy. And of course, the woman with nephropathy is at higher risk of developing complication. And remember, of course, that it will be referred to the renal doctor, okay, or the nephrologist. So here also remember that we will score her 3 in the VTE scoring system. Sickle cell disease is a score 3. Current intravenous drug user is a score 3, right? So the risk assessments are very important for the VTE risk assessment. You remember it well, and don't please be confused between the small for gestational age risk factors or with the preeclampsia risk factors. Here, this table, you have to remember it by heart, okay? I need your photographic memory in the exam to remember the table very well, okay? So you can apply it in the exam and count the score for the lady, calculate her risk, and give the appropriate prophylaxis. Okay, so other risk factors that would be considered as 1-1, okay, is as follows. And this is in the yellow part of this table. In the yellow part here, in this third group of women, this is 1 by 1 mainly, okay? So a family history of unprovoked or estrogen-related VTE in first-degree relative. So how it come in cases? It will come in the scenarios as the woman had her sister or her mother developed DVT, okay, while she was pregnant. This is a first-degree relative, and with history of DVT, this family history is 1, okay? And this is different from that woman herself carry risk of thrombophilia or not, okay? Non-low-risk thrombophilia without a complication, without a VTE. So again, the woman carries the risk, okay, carry only the risk of this thrombophilia, but she is a low-risk thrombophilia and no VTE. And you have to remember the types of the low-risk thrombophilia and the types of the high-risk thrombophilia. So age more than 35. Okay, so this is where the age more than 35, 35 itself is not included. Obesity. Obesity is considered as 1 or 2. Take care, very important. If the BMI more than 30, okay, 30 or more will take 1, but 40 or more will take 2. So morbid obesity is 2 in the risk factors. And this is fixed for the antenatal and the postnatal, so be careful of the obesity. Parity, 3 or more. So when he gave you in the history that the lady is para 4 or para 3, give her 1. Smoker, any number of cigarettes is 1. Gross varicose veins. So by the examination, you found a gross varicose vein. She is a smoker. That means her risk is 2. 2 does not require low molecular weight heparin during the pregnancy, but in the postpartum, required for at least 10 days, as you remember, right? Obstetric risk factors, which is complication that can occur during the pregnancy and increase the risk. That's why it's important that we repeat the VTE risk assessment. So a woman developed preeclampsia in the current pregnancy. This is a score 1, increased her score to 1. The woman had conceived with ART or IVF, will have 1, and this is antenatal only, okay? So this is not considered in the postnatal risk assessment. Multiple pregnancy, this is 1, okay? So this lady who have, for example, conceived by IVF, she had twin pregnancy and developed preeclampsia, so now her risk is 3, right? So when the risk is 3, so consider for her the low molecular weight heparin from the 28 weeks, right? Yes, well done. Okay, so how about the factors in the postnatal that it will help me in the calculation of the risk? Yes. Cesarean section in labor. That's mean the lady had emergency cesarean section. This is a score 2 in the postnatal, okay? Score 2 in the postnatal. So a lady without any risk factor, she delivered by emergency cesarean section because of non-progressive labor. That's mean she will receive at least of 10 days postpartum, okay? Elective cesarean section. So this is a different one. That's why when we, count the ladies about the delivery, for example, for difference between emergency cesarean section and elective cesarean section, that the emergency had increased risk of VTE, score 2 instead of 1, and also, as all of you know, increased risk of other complications like infection. A woman delivered by mid-cavity or rotational operative delivery. So a woman had occipitoposterior baby delivered by rotational delivery. So score 1 in the postpartum. A woman had prolonged labor, more than 24 hours, like a case of induction, and it was prolonged, ended by emergency cesarean section. Okay, so it's 1. Preterm, less than 37. A preterm less than 37 in the current pregnancy after her delivery, score her 1. So a woman delivered at 32 weeks. Okay? This is score 1 for her, regardless what is the mode of the delivery. Delivered by cesarean section at the 32 weeks, that's mean her score now 2. Stillbirth in current pregnancy. If the woman, unfortunately, okay, have baby died, so increase her risk to 1. Other transient risk factors, and this is, as I told you, it's transient, it's temporary, okay, need for the low molecular weight heparin, and it's a special scenarios, like any surgical procedure in pregnancy or in the postpartum, except immediate repair of the perineum, like appendectomy. So a woman had appendectomy while she is pregnant. Anyway, any woman who is admitted need to receive low molecular weight heparin, but her risk is now 3. And this is only for temporary period, till recovery and discharge from the hospital, okay? Not to continue with the low molecular weight heparin. Postpartum sterilization for a woman, let's say she came back, okay, for a postpartum sterilization. This is a readmission or a procedure apart from her delivery, right, within the 6 weeks postpartum. So that means also she will need to cover as a temporary or transient risk factor during her admission. Hyperemesis and dehydration. So of course, again, this is transient, okay, because the dehydration and hyperemesis increase risk of VTE. OHSS, and OHSS is actually a special scenario, and it's not only for the time of the treatment, it's for the first trimester. The whole first trimester, the woman should receive the low molecular weight heparin, okay? So a woman conceived by IVF, she had OHSS as a complication, a late onset, for example. So when you discover the OHSS, maybe it's moderate or it's a severe or whatever, okay? So this woman require the transient or the temporary low molecular weight heparin prophylaxis. For how long? For the first trimester. Okay, current systemic infection, this is 1. Okay, immobility, this is 1. So a woman stayed in bed, this is 1. A woman who had systemic infection, this is 1. Okay, so dear friends, as you can see here, this is notes at the end, and those notes are very common, tricky point in your exam. This is if the woman at low risk thrombophilia is unknown with a family history of VTE in a first relative. So this will mean that postpartum thromboprophylaxis will be continued for 6 weeks. And here is my famous quote, and I will say that for this woman, we learned that low-risk thrombophilia is score 1, and family history is score 1. But both together combined equal 6. So 1 plus 1 equal 6. Okay, so you will give her postpartum thromboprophylaxis for 6 weeks. Very common exam scenario. And as you can see here, it's only explained, you know, at the bottom of the long table. So that's mean they are testing you in the details of the details. They want to make sure that you have read the guidelines carefully, right? And you have taken notes. BMI, as we learned, 30 or more is 1, but BMI 40 or more is 2. And this is fixed for antenatal risk scoring and for the postnatal as well. Okay, so this is the famous table of the special scenarios, and the special scenarios are very special and very common in your exams. So you have to study this table very carefully. You will learn a lot of the exam tips from this table alone. And those are the cases, by the way, that if you try to solve it or try to calculate the risk using only the table, you will be a bit confused and maybe you wouldn't get it correctly, right? Why? Because the missed part in the calculation or in your question, you're trying to make a logic answer is missed, okay? So you have to study this table very careful. And this is Appendix 4 in the guideline. So, Dr. Rabah, what are the secrets of this table? As I told you, this table is very common in your exam to explain a lot of the questions, especially in the tricky eMRCOGs. So, the summary of guideline for thromboprophylaxis in women with a previous VTE or thrombophilia. So, the woman will be here. We are discussing a woman with either a previous history or a tendency for developing a VTE, and this is regardless of other antenatal or postnatal scoring system. So here we divide these ladies into a very high risk group or high risk group or intermediate risk group or a low risk. And let's see what is the examples of each group of the 4 groups and what is the management for everyone. The very high risk groups is a woman who had VTE previously. So she had the history, personal history, herself. She had VTE risk, plus she is on a long-term oral anticoagulant. Oh my God. So that means she is at higher continuous risk for VTE. When this woman become pregnant, okay, when this woman become pregnant, so we will recommend, first of all, this case must be managed with a specialist hematologist advice, okay? So require a specialist management by expert in hemostasis and pregnancy. This is to start with. Her antenatal prophylactic dose is a special dose as well. And we call it, it's a high dose, low molecular weight heparin prophylaxis. What is a high dose prophylaxis? You know, my dear friends, that there is difference between the prophylactic dose of low molecular weight heparin and the therapeutic dose of low molecular weight heparin. If we speak about the prophylactic dose here, okay, we will have a special higher dose called the high dose prophylactic. What is the high dose? It's actually 50 to 75% of the therapeutic dose. So it's a bit higher. So she will have antenatal high dose prophylaxis of the low molecular weight heparin and at least 6 weeks postpartum of low molecular weight heparin, or until switched back to the oral anticoagulant therapy, right? Which we call it a bridging. So this lady, she will have high dose prophylaxis starting from early pregnancy, right? Until postpartum, 6 weeks, or till she switched back to the oral anticoagulant. Okay, so this is the first one in the first group. Okay, personal history which is considered as high risk. She is already on oral anticoagulant for a long term. Okay, what is the second example in this group? Second example is a woman with antithrombin deficiency or antiphospholipid syndrome with previous VTE. Okay, so the lady, she had now a syndrome. She had manifestation of the antiphospholipid syndrome, right? So antiphospholipid syndrome diagnosed, like, for example, a woman with bad obstetric history, like recurrent pregnancy loss or IFD, they had a workup and they discovered that she had antiphospholipid syndrome. So this is now considered as the high risk, very high risk. Or a woman with thrombophilia, but manifestation of the thrombophilia is there. So personal history of VTE plus thrombophilia gene, okay? That's why we called the asymptomatic thrombophilia, okay, as high-risk thrombophilia, as intermediate risk, or the asymptomatic low-risk thrombophilia is a low risk. So see, thrombophilia can be a very high risk if associated with history of VTE, or can be intermediate or a low risk accordingly, if no symptoms before. Okay, so again, high risk is high dose thromboprophylaxis and require a specialist management with expert in hemostasis and pregnancy. Second group is the high risk group only, not very high risk, it's only high risk. Which woman is high risk? This is any woman who have unprovoked VTE, means a VTE not related to surgery. So a VTE without genes, without syndromes. We will recommend normal prophylactic dose, prophylactic by low molecular weight heparin from start of antenatal, okay, and 6 weeks postpartum. So this is straightforward, and this is like the table. This is the group 2. Third group is intermediate risk. And the intermediate risk is like a woman who had asymptomatic high risk thrombophilia. So again, what is the meaning of asymptomatic? That no personal history of VTE. She carries the gene of high risk thrombophilia. Which gene? Like homozygous factor 5. Okay, Leiden. Or compound heterozygous. So it's either homozygous. Homozygous means that she had the both, okay, pair of genes are problematic or faulty, okay? So homozygous. Or compound heterozygous, or protein C or protein S deficiency. And of course, protein C or protein S deficiency is very serious. So high risk thrombophilia is intermediate risk. In the table, it was 3. So here is the trick part. What is the trick part? This need referral to local expert. Consider antenatal low molecular weight heparin, okay? And this is from 28 weeks, by the way, in the stem of the guideline and in the table, right? So we consider low molecular weight heparin during the antenatal from 28 weeks, but recommend postnatal prophylactic low molecular weight heparin for 6 weeks. So which one is a higher level in the recommendation? Consider or recommend. You know the game, and you know that the eMRCOG is the game of words, right? So which one have the higher evidence? Consider or offer or recommend. Which one you have to choose in the exam if you have to choose between the two of them? Of course, you will go to the recommend, right? So in the exam, he will give you this simple case, and he will tell you, which is also a very important recall, and it's tricky, okay? It's tricky, I know it. And I would like to remind you, because everyone will get it wrong unless you know this tip. This is to recommend postnatal prophylactic low molecular weight heparin for 6 weeks. And There's a very famous example in Dr. Konji book of the questions. There's one question on this, and it is the same, recall one. So, recommend postnatal prophylaxis, low molecular weight heparin for 6 weeks. This should be the answer of this tricky question. Because if you have to choose between consider and recommend, you will go for recommend. The best, of course, option ever, that you have the same line as the guideline, the complete line. But when you are in a situation that you have to choose between the two options, go for recommend. Then we have here a single previous VTE, but with surgery, which is called a provoked VTE. So VTE related to surgery, consider the antenatal low molecular weight heparin from, okay, not routinely recommended, but recommended from 28 and 6 weeks postpartum. Okay, so here is a score 3 as per the scoring system. There is no tricks here. Low risk and low risk, okay, is the group number 4. The group number 4 is a woman who have asymptomatic low risk thrombophilia, like prothrombin gene mutation or factor V lead, heterozygous factor V lead, not compound, not homozygous. Okay, so what I will do for this, it's considered in the antenatal as a single risk factor, 1, 1, 1, 1, okay, in the calculation. And look here, recommend 10 days if other risk factor in the postpartum. Yes, because 1 plus 1 in the postpartum equal 2, and 2 in the postnatal equal 10 days prophylaxis. That's okay. What is the problem so far? No problem. But there is a special risk factor that's called family history, right? So this low risk thrombophilia in the postpartum is 1. The special risk factor is family history. Okay, family history of VTE in a first, okay, significant family history in the first degree relative. That's equal 6. So 1 plus 1 equals 6. 6 what? 6 weeks postpartum prophylaxis. Okay, friends, so that's very important. And I can tell you that if you have revised, okay, the pathway as we learned now, this would be very easy for you. Consider it as a game of just apply the information. You know the rules now, so you will win the game. Okay, right? And this is part of the algorithm, okay? And I choose the postnatal assessment. And let's apply the game, please, right? How to apply the calculation. Okay, let's have examples, please. A patient delivered by SVD, okay? And her BMI is 45. So no other information. I have only the risk of obesity. Risk of obesity here is 2. So what is the recommendation? Recommendation is at least 10 days postpartum. Well done. Okay. So dear friends, again, here, 10 days postnatal prophylaxis. Patient delivered by emergency cesarean section. What is the score of that? It's 2. No other risk factors are there. So it's again 10 days postnatal prophylactic low molecular weight heparin. 27 years. Here age is not a factor. Delivered by a mid-cavity forced delivery. So this is score 1. What is the advice for score 1? If it is lower than 2, so early mobilization and avoidance of dehydration. So it's not nothing, it's early mobilization and avoid dehydration. Patient 41 years. So this is age. Age is 1 score. BMI 37. So we learned that BMI, if 30, okay, more or more, this is 1. She spent 26 hours in labor. Okay, so prolonged labor is a score 1. She then delivered by assisted vaginal delivery. She developed a severe postpartum hemorrhage. Severe postpartum hemorrhage is 1. So please calculate the risk here. You will find that's 1, 1, 1. It's 4. So if it is 4, because here in the guideline they said if more than 3 risk factor, consider extending thromboprophylaxis with low molecular weight heparin, right? So extend the use of low molecular weight heparin, right? Right? This is the answer for that question, okay? So just people apply it, please, okay? Apply it the same, and don't forget, okay, the risk factor already are given there, so you don't need to study it from here, or otherwise you are confusing yourself, okay? And remember, okay, that those are the most common cases in your exam. If you apply the cases correctly, you can, play again the same game with your study partner, and you will find a lot of fun in that. So, contraindication to low molecular weight heparin table is important. Okay, this is for single best answer questions. Okay, like for example, a woman had bleeding disorder or active hemorrhage or thrombocytopenia or severe renal disease, severe liver disease. Okay, so that's very important to be considered. Also, this is the suggested thromboprophylactic doses for antenatal and postnatal low molecular weight heparin. Okay, this is also to keep it in your mind. Please, in this guideline, you have to know very well the prophylactic doses. Okay, and for the acute VTE guideline, you have to know the therapeutic doses. Okay, so I have now reached the end of my presentation. Okay, and I will go to solve some questions. Let's apply what we have learned already on some of the questions, so you guys have a look to the exam scenario, how it come in this exam. This is the time for solving questions, and allow me to go to the eMRCOG question bank, and let's find out a mock test for, yes, for the VTE. So, dear friends, this is the VTE mock test, okay? And we will go through this mock test together. I'll select a few questions to apply, okay? Okay, so here the question number 4, it says, the pregnant woman described below is at risk of venous thromboembolism. For each woman, select the single most appropriate thromboprophylaxis that you will recommend from the above option list. Actually, it's the below option list. Okay, so the woman has started 3 recurrent. She had, 3 recurrent miscarriage. So this is bad obstetric history, investigated and found to have antiphospholipid antibodies. So the lady have the syndrome here, okay? So this is considered as high risk or a very high risk. What do you think? She developed a DVT also, okay? So he is now affirming, okay, that she had a very high risk in the first pregnancy that ended with a full-term vaginal delivery. She is now, in this current pregnancy, is 8 weeks. So for this very high risk woman, because you have to ascertain the situation, and this is a very clear history, very high risk. Remember the table? Yes, apply it, please. So what this woman need? You know that she need a high prophylactic dose, right? So what is the answer? Look to the options, my dear friends, and find the answer that most match what you have answered in your head first, okay? Otherwise, if you go to the option first and then try to find the answer in between, you will be a bit confused, and probably you will forget what was the question at the first beginning. Okay, so here, let's have a look. I have option with higher dose and another option with higher dose. So let's compare between them. The option of higher dose is 50 to 75% of the full anticoagulation doses antenatally and up to 6 weeks postpartum. Okay, so this is sound correct for me. Let's again compare it to the other one. Low molecular weight heparin with higher dose, 50 to 75% of full anticoagulation doses from 28 weeks and up to 6 weeks. No, it's not from 28. So the correct answer should be M, right? This is the best in between all the options, right? Okay, so let's choose another question. to apply what we have learned today. If you allow me, my friends, I will skip some questions, okay, because it's on the acute VTE, which is another very important table, a guideline, but we have already revised it in the previous session. So here, let's have a look to the question number 8. And here, very important when you solve an eMRCOG to look to what is the leading part or the sentence in the scenario. Here, he wants single most appropriate thromboprophylaxis that you would recommend, so it's fine. The woman is 30 and she was tested for thrombophilia and found to have protein C deficient. Okay, so do you remember what is the protein C deficient? Is it a low-risk thrombophilia or high-risk thrombophilia? It was a high-risk thrombophilia with intermediate risk, with score 3. Yes, very well. You remember the table. The test was performed because her sister had a DVT in the pregnancy. Okay, so she had significant family history as well. Okay, so her sister also had protein C deficiency. So what do you think we will offer her as a recommendation? So of course, this lady now have a score of 3 plus 1, which is equal 4. And the rule says, if it is 4 or more, start from the beginning of the antenatal until 6 weeks postpartum, right? So please find an option that match with the answer. Okay, so let's find it together. From now, okay, from now it's fine. Until 6 weeks postpartum, okay? So okay, this is the question number 9, and it's again most appropriate thromboprophylaxis. What is the story? She is 36 years, asymptomatic, okay, and being found to have antiphospholipid antibodies. Okay, that's a very good question because antiphospholipid antibody alone without any symptoms is considered as one risk factor. Her BMI is 33, which is another one risk factor. She is 8 weeks pregnant and have no other factors and no significant family history. Okay, so age is one risk factor because she is more than 35. Total score of this lady is 3, right? Antiphospholipid antibody is 1, since it's only antibody, no previous history of DVT. This is not the antiphospholipid syndrome associated with poor pregnancy outcome before. No, this is only a presence of antibody, which can be temporary. So it's 1 plus age 1 plus obesity 1, because this is BMI 33 only. So total score is 3, and 3 equal low molecular weight heparin from 28 till 6 weeks postpartum, right? Yes, okay, and the option is here. Low molecular weight heparin from 28 until 6 weeks postpartum, right? So see how easy is it? It's very easy, right? Yes. Okay, so dear friends, I hope that the key point is that I have discussed today with the application of questions and the famous scenario on the low molecular weight heparin prophylaxis during the pregnancy and postpartum is useful. However, I would recommend you that you go through the whole guideline, my dear friends, and if you have any queries or any question, please share it with us on the group, and you're welcome anytime. Thank you very much.